Thanks for joining us on this Monday night. I'm Kelly Swoop. Jamie has the night off. Jobs, care, and justice. A rally cry chanted outside of the State House in Annapolis tonight. Many people worried about the future of our health care in Maryland. WMER2 News' Janae Wright was in Annapolis today. Janae, what are some of the issues that they're concerned about? I'm sure they impact all of our lives.
You're right, Kelly, they do. Now, if you or a loved one has had health issues, you know the bite it can take out of your budget. And we all saw the effect on healthcare workers during the pandemic. Just a few of the 9 topics for which they're advocating.
My nursing home, we are struggling right now with not having enough staff to take care of the residents.
Healthcare was at the top of these people's minds Monday night at a rally in Lawyers Mall.
Healthcare is a human right.
Fight, fight, fight.
Rhonda White says since the pandemic, she has seen a major shortage in nursing home workers and other healthcare providers, and she says it's not fair to let the patients suffer.
A lot of elderly in the nursing homes, they pay for service and they are not rendering what they need to get.
We spoke to a few other folks who say the state of Maryland has major work to do when it comes to the current healthcare systems in place. People spoke about the high price of prescription drugs that they can't afford, being denied health care services, and many are even disappointed with what they say is a lack of support for our health care workers.
I think the COVID pandemic showed us how much we owe the frontline workers and our health care workers who went to work every day, took care of us and our relatives, got sick for us. Some of them died for us during that pandemic, and we owe them I think more than we can repay.
Crystal Parker tells me all of the 9 topics are equally important. She says some of the legislation even ties into others. She says the main point, making sure health care is affordable and accessible.
Healthcare is a human right, so no one should be able to decide the cost is worth more than our care. And you can't live a quality life when you have to decide between if you're going to heat your home, if you're going to have food to eat, or if you're going to be able to get medicine to treat your documented illness.
Jerry Kickinson says it was important for him to be out here because he says lawmakers need to know how the people feel.
If we want them to do the important stuff, we have to tell them what's important to us. Otherwise, how will they know?
Now, so far, only 2 of the 16 bills related to health care have made it through the original chambers and are now in the opposite chamber. The Home Care Workers Act of 2024 and the Access to Health Care Act. But still, all of these bills have a long way to go before possibly reaching the governor's office. Kelly.